Teeth grinding, known as bruxism, can occur during both sleep and wakefulness. Approximately 15% of children are affected by bruxism. Grinding teeth during wakefulness is more common. Bruxism is most prevalent in children aged 6 to 12 and is more common among boys. The most common cause of teeth grinding is stress and anxiety, accounting for about 40% of cases. In these instances, stressors can vary widely, including school pressure, home environment, or social challenges. During periods of stress, stress hormones are released, increasing muscle tone, including that of the jaw muscles. This is particularly evident during sleep when there is less conscious control over muscle activity, leading to muscle spasms and the clenching or grinding of teeth. There is a hypothesis that pinworm infection may cause bruxism, but this is not well documented and primarily based on anecdotal evidence and observational studies. Some studies suggest a significant link between bruxism and pinworm infection, with a correlation observed in about 45 to 50% of cases where children with teeth grinding also have pinworm infections. The possible underlying cause could be the restlessness caused by the nocturnal itching associated with pinworm infections, leading to restless sleep and teeth grinding. Additionally, it is theorized that pinworm toxins might affect the nervous system and increase muscle tone, potentially leading to bruxism in the case of jaw muscles. However, there is no direct correlation or explanation, and strong evidence is lacking. In about 15% of cases, teething or earaches can lead to teeth grinding, especially in younger children. Teething, the process where new teeth emerge through the gums, can cause discomfort and pain for infants and young children. Grinding may be an unconscious response to alleviate this discomfort. Misaligned teeth, present in 15 to 20% of cases, can also cause bruxism. During chewing and biting, uneven distribution of force occurs, creating pressure on certain teeth and jaw muscles. This triggers involuntary grinding to compensate for the imbalance. Attention deficit hyperactivity disorder, ADHD, may also lead to bruxism due to muscle spasms and difficulty in controlling movements. Furthermore, certain psychotropic medications, including antidepressants and antipsychotics, can cause teeth grinding as a side effect. Consequences of teeth grinding is tooth damage. Tooth damage is the most direct impact of bruxism is on the teeth. Also, zero regular grinding can strain the temporomandibular joint, TMJ, leading to disorders of this joint. Symptoms may include pain, clicking, or difficulty moving the jaw. Prognosis of bruxism: many children outgrow bruxism without any specific treatment, especially if it's related to stress or dental issues like misaligned teeth. Management of bruxism typically involves mouth guards or splints. They protect the teeth from grinding damage and can reduce muscle strain. Dental correction: if misalignment of teeth is contributing to bruxism, orthodontic treatment may be recommended.